In this video, we're going to talk about medical tests and the different results that you could get when you take a test and analyzing how much we should believe or not believe the results that we get. So when you take a medical test, there are 4 things that could happen. You could get a true positive. And a true positive is when you take the test and it says you have a condition that you actually do have. So this would be if a female who is pregnant takes a pregnancy test and the test comes out positive. The test says, yes, you're pregnant, and she actually is pregnant. And sometimes the percentage of time that a test correctly gives you a true positive is known as sensitivity. A false positive is when a test incorrectly tells you that you have a condition. So it would be like telling a guy that he is pregnant. That's not possible. That's a false positive. It is anatomically impossible for a guy to be pregnant, so it would be a false positive if a male took a pregnancy test and it came back positive. A true negative is when a test tells you that you don't have something and you really don't have it. That would be like a guy taking a pregnancy test and it comes back not pregnant. That is correct. He is not pregnant, and so you want the test to tell him that he is not pregnant. And the percentage of time that the test correctly gives you a true negative is sometimes known as specificity. And then the 4th thing that can happen is a false negative, where the test incorrectly tells you that you don't have something when you actually do have it. And this would be like somebody taking a pregnancy test when they're actually pregnant, but the result comes back not pregnant. And this can happen a lot during the early stages of the pregnancy before your hormones go all crazy. Sometimes girls will take a pregnancy test and it comes back not pregnant when they actually are. They just didn't wait long enough to take it. So the 2 true conditions, so the true positive and true negatives, those are both correct. That's either saying you have this condition and the test says you have it, or you don't have the condition and the test says you don't have it. Those are both the correct test results, telling you you do have something you do have, or you don't have something that you don't have. The incorrect results are false positives and false negatives. If you get a false positive, that can make you panic thinking you have some condition when in fact you don't actually have it. Or a false negative might make you think that you don't have something when you do, and so that might delay treatment, and it might get worse, and it'd be easier to treat it earlier on. So it's very bad to get a false positive and a false negative, but they do happen probably more than we like to admit. So let's look at a couple of examples. Let's suppose that 10,000 women with breast tumors are given mammograms. And 1% of people who have tumors have malignant or cancerous tumors, and the other 99% actually have benign tumors. And so if the mammogram is 85% accurate, how many of the women whose results show a malignant tumor might actually have a benign tumor? So we want to know, what are the odds when someone has a mammogram if it shows that it is malignant, is that correct or not? Do we need to go on to a biopsy or some more invasive procedure? So I'm going to set up a little chart. We have all of our possibilities with either a positive or a negative mammogram result, as well as the tumor either being malignant or benign. It's either cancerous or not cancerous. So we know we have 10,000 people, and of those we know 1% actually do have a malignant tumor. So I'm going to calculate 1% to see how many people should get should have a malignant tumor. So 100 people have a malignant tumor. That tells us that the remainder have benign tumors. Okay, so these are the numbers we should get, with 1% having cancer, the other 99% not having cancer. Well, this test is 85% accurate, so that means it's going to pick up on 85% of the cancerous tumors. So of the 100 people that actually do have cancer, 85 of them are going to be told, hey, you have cancer, and the rest of them are actually going to get a negative mammogram. These 15 people are going to be told you don't have cancer when they actually do. So you see, that's kind of problematic. Then the test being 85% accurate means that 85% of the time it's going to correctly identify you don't have cancer when somebody has a benign tumor. So it's going to get 8,415 people correct in saying this tumor is benign, and the remainder is going to give a false positive. There's going to be 1,485 people that get a positive mammogram when in fact they don't actually have the cancer. So if 10,000 people get a mammogram, there will be 1,570 positive results, and there will be 8,430 negative results. But again, of those 1,570 positives, only 85 actually have cancer. The rest are getting a false positive. And of the 8,430 that are told you don't have cancer, 15 actually do. That's a false negative. So we want to know, what is the probability that somebody actually does have cancer if they get a positive test? So if we look at the number that have cancer divided by the number that had a positive test, we see that that's, what, 5.4% that get a positive test actually have cancer? So there's no need to panic. If you get a positive mammogram, there's still only a 5% chance that you have cancer. You'll go in for the biopsy or whatever the next stage is, but there's still almost a 95% chance you're okay, and the doctors are just being super precautious. And so maybe you're thinking, oh, my test came back negative, I still think I have cancer. Well, let's see what the odds of that are. If we look at the number of people with a negative result, and of those, 15 actually do have cancer out of the total, there's actually an even smaller chance. It's what, move that decimal spot over, 0.18% of people that get a negative result actually have cancer. So if you're told that you have a negative mammogram, there is a very tiny chance that you actually have cancer, so you really don't need to panic either. If you got a negative result, it's probably not worth going and seeking a second opinion unless that you have other side effects that make you really, really question it, because the odds are in your favor that you don't have cancer if you get a negative test result. Let's look at another example. So the New York State Health Department estimates a 0.3% rate of HIV for the general population. Tests for HIV are 95% accurate in detecting both true positives and true negatives. And we want to answer some questions with it. So the questions are saying, what percentage with HIV test positive? And of those who test positive, what percentage have HIV? And questions like that. So we're looking at the percentages, but we're not really told a base population. And often when you're working with percentages, you can just kind of pick a starting value, and then as long as you base everything on that, you'll get to the right answer eventually. So let's just say that we have 10,000 people. Okay. So New York State Health Department says that 0.3% have HIV. So if we convert that 0.3 to a decimal, forgot my equal sign, so 0.3% times our total, that means if we have 10,000 people, 30 should have HIV, and the remainder should not. The test is 95% accurate, so that means 95% of the time it's going to flag those people that have HIV with a positive result. And then the rest of the time it's going to mess up. It's going to tell people with HIV that they actually don't have it. That's not good. They might have unprotected sex and infect more people. Also, since it's 95% accurate, that means that 0.95% of the time it's going to tell people without HIV that they don't have it. But that means it's also going to tell some people that they have HIV that don't. So when we give 10,000 people the test, we're going to have 527 that test positive, and the rest test negative, and we can see the number of people that actually have it and don't have it. So our question says, of those with HIV, what percentage test positive? All right, so we're just looking at the people with HIV. The percentage that test positive will be the 28.5 over the 30, and so that tells us that 95% of people are going to test positive that have the HIV. It says, of those who test positive, what percentage actually have it? All right, this time we're looking for the ones that test positive, and how many actually have that. So we'll take our 28.5 divided by the 527, and we see that that number comes out to be, what, 5.4%? So again, just because you get a positive test doesn't mean you should panic. Only 5.4% of the people with a positive result have HIV. So that kind of gets us to part C. It says, suppose a patient tests positive for the disease, how would we describe the patient's chance of actually having it? It's still very slim. It's only 5.4%. So I would definitely go get a second opinion before I started the course of drugs for HIV, because that's a big invasive therapy. You don't want to go through that when there's only a 5.4% chance you actually have it. Go get a second opinion, do a more invasive test, whatever it takes to actually determine, Are you one of the 5% that get a positive result that have HIV, or are you one of the 95% that get a mistaken false positive? Let's do one more. Okay, so this one says, for a typical drug urine test, sensitivity is 38.2% and specificity is 98.9%. So remember, sensitivity is the probability of a true positive, and specificity is the probability of a true negative. So this time, instead of just saying the test is 95% accurate and using that number for both, now we have different values for the true positive and the true negative, but the process works kind of the same. So Jen manages a chain of clothing shops with a total of 276 employees. She has decided to have her employees randomly take drug tests so that she can maintain a drug-free work environment. She knows that in general, 8% of people who work in retail use illegal drugs and 92% do not. When the test results come back, she is surprised and saddened to see that Clarissa, one of her best employees, has a positive result. The test has a high specificity, again meaning a high percentage of true negatives. Should she fire Clarissa? Alright, so let's see. This one's a little bit different, and I set up the chart differently on this one just so you can see it doesn't matter how you set up the chart. As long as everything's labeled and you're keeping track of what goes where, you can have your chart going either the way I had it in the first two examples or the way it is on this example, which is also the same way in your minor lab for the week. And again, it really doesn't matter as long as everything is labeled. Alright, so let's see. What do we know? We know that 8% of people who work in retail use the drugs. So if I calculate what 8% of her employees would be, that should tell us the number that use illegal drugs, and then everybody else is assumed to not use illegal drugs. And one thing while I'm thinking about it, on the previous example in this one, we see that we get decimals representing the total number of people. I know that you cannot have 0.08 of a person, that doesn't make any sense, but please leave it in the 2 decimal place form. It makes all the numbers work out better, and at the very, very, very final step, if you want to round it to the nearest person, you can. But please don't pre-round your problems. You get some really bad decimal mistakes if you do. So even though while we're working, I know you can't have 22.08 of a person, just leave it like that for now, and then we'll sort it all out in the end if we need to. Again, it just helps with rounding and not making mistakes if you leave it in fraction form until the very, very end. Alright, so we know the number of employees that do use drugs and don't use drugs according to the 8% that do and 92% that don't. And it tells us that sensitivity is 38.2. So again, sensitivity tells you the probability that somebody who uses drugs tests positive. So I'm going to calculate 38.2% of the people that use drugs, and that should be the number that get a positive test. And so that tells us that everybody else that uses drugs is going to get a negative test. And that's interesting because more people are going to test negative that actually use drugs than test positive. That's not good, but that's a very low sensitivity, meaning it's not very good at picking up on true positives. Their specificity is 98.8%, so that means 98.8% of the time it's going to give you a negative if somebody doesn't use drugs. And then the remainder of the time, it's going to tell you that somebody does use drugs when they really don't. So we can see that if you test 276 employees, it's going to come back with about 11 using drugs and the rest not using drugs. So Clarissa tests positive, and we want to know, should she be fired? So we want to see what's the probability that somebody tests positive when they don't use drugs. So people that don't use drugs divided by the people that test positive gives us about a 26-27% chance that somebody's going to test positive when they don't actually use the drugs. That's kind of a high number. You know, you don't want to be 26% chance of being wrong and make kind of rash decisions based on that, because that's a high chance that you are wrong. So maybe she shouldn't fire Clarissa. Maybe she should try a different test or do something else, because that's a very high chance that Clarissa doesn't use drugs even though she got a positive test. Of course, maybe Jen doesn't care. Maybe Jen just wants to get rid of her for other reasons. But I would definitely question that if I was Clarissa, if I really wanted to keep that job.